Breaking news update. Due in part to a particularly rainy late spring and early summer, researchers at the CDC headquarters in Georgia have identified an outbreak of yet unknown magnitude affecting the east coast of the United States. The CDC has identified cases of Rift Valley fever, a mosquito-borne pathogen, in no less than 300 farms along the eastern seaboard. The CDC is reporting that the virus is in fact able to make the jump from animals to humans via mosquito bites and contact with the tissues and bodily fluids of infected animals or the corpses of such animals. Farmers, slaughterhouse personnel, and animal healthcare workers are being asked to exercise extreme caution when dealing with herd animals that have potentially been exposed to the virus or the mosquitoes that carry it. We go now to senior correspondent Al Paca reporting in from the field. Al?
Thanks, Hans. We're here at Farmer McGregor's Goat Emporium, which CDC officials have identified as the likely place of origin for the outbreak. Following the acquisition of several male breeding goats from several small farms in Kenya, nearly 80% of McGregor's does and 100% of their neonates have rapidly died. The McGregor farm, located between several ponds and a landfill, was beset by mosquitoes following the heavy spring and summer rains, leading to several of McGregor's farmhands testing positive for mild cases of Rift Valley fever. One such employee, Hector Howland, progressed into a severe case of Rift Valley fever, requiring extended hospitalization for extremely high fever and swelling of the brain. The farms surrounding Mr. McGregor's soon found themselves experiencing the same sweeping deaths among their pregnant livestock and their young. I'm here with CDC official Dr. Gary Indiana, hoping to shed some light on the outbreak. First of all, Dr. Indiana, what is Rift Valley fever, and how severe of a disease is it?
RVF is a particularly troublesome virus, especially for pregnant livestock, because infection with the disease causes spontaneous abortion and almost always results in the death of the neonate and very frequently the mother as well. It's a particularly difficult disease to contain and prevent since it's readily transmitted by mosquitoes, and infected female mosquitoes pass it on to their offspring, leading to huge numbers of infected mosquitoes. The virus is quite severe in a large number of ruminants and other typical farm animals, and also highly zoonotic. 98% of human cases are mild, usually limited to a self-regulating fever. However, 2% of human cases progress into severe symptoms, including encephalitis, fulminant hepatitis, and hemorrhagic syndrome similar to hantaviruses, such as Ebola.
Fascinating stuff. So are there any precautions that our local viewers can take to limit their exposure to the virus?
The best way for humans to avoid contracting RVF virus is to avoid infected livestock and protect themselves from mosquitoes using nets and the like. Infection is really more of a problem for people directly involved in handling livestock, such as farmers and animal health care workers.
Can you give any recommendations to slaughterhouse employees and animal health care workers to help prevent contracting the disease?
For those such professionals, the CDC is recommending that they abide by universal bloodborne pathogen precautions and always use proper PPE when dealing with potentially infected animals. Research has shown that the virus can be inactivated on clothes and surfaces via the use of strong detergents and 10% solutions of sodium hypochlorite. That's bleach. In terms of farmers protecting their herds, it's recommended to find a place to graze them far from any standing water and to immediately report any spontaneous abortion or large-scale neonatal deaths to the CDC immediately so that we can dispatch RVF containment teams to assess the risk to you and your animals.
Thank you for the important information, Dr. Indiana. Now back to Hans in the studio. Hans?
Individuals exhibiting the symptoms now shown on screen are being advised to quarantine within their homes and avoid sharing clothing, cups, and utensils with others within their household. If you or a loved one have potentially been exposed, please call the CDC hotline below.